called WTF Health, which is what's the future? Health, and it's all about health innovation, and WTF is wrong with it right now. So I travel around the world and I interview people. It's basically what I do, and I get to talk about what's going on in health technology, health IT, the innovation space, the investment space, so lots of startups, VC funds. I've interviewed about 500 people in the last 4 years, and now we're going to add this guy to the list. So Craig.
Thank you.
Yeah, I know, I'm excited. All right, so I don't get to often speak to someone of your caliber, so why don't you go ahead and just for everybody here, introduce yourself in the quickest way possible so that
Sure.
we don't put people to sleep with your life history.
Yeah, great, thanks. Yeah, so Craig Richardville, I was with ProMedica Healthcare System, starting out my career for 12 years, then was Carolina's healthcare system, which is now Atrium Health, for 21 years, and the last 12 of those, I was the Chief Information and Analytics Officer for the healthcare system. And so left the system earlier this year, started doing some things on my own, started looking at a lot of startups, a lot of interesting things that are happening within the industry, a lot of new entrants coming in. And so here I sit here, so I got asked a couple months ago to come in and have spend some time with you guys, and looking forward to the half-hour conversation.
Yeah, likewise. All right, so I want to jump right in, and I want to talk about trends and innovation, because I think that this crowd, I mean, it's the end of dinner, it's the end of a long day, we're a couple drinks in, right? So, so I want to jump right off with something that happened last week with the CVS-Aetna merger right there, and really looking at some of these consumer health companies, not only them, but even the Amazon, Berkshire Hathaway, JP Morgan alliance there, and their new healthcare company headed by Atul Gawande, and some of these other players like Walmart, who are getting into care delivery, and they're starting to creep into the healthcare industry, and the industry is flattening. Right. So from a health system perspective, as somebody who's responsible for technology and innovation, what are you to do? What is the impact of something like this?
Well, this is definitely the most interesting times of my 30-year career within healthcare and IT. For me, I'm actually a patient of CVS, for example, right? So I think the health systems, at least the ones that I'm familiar with, and the whole industry, is really becoming, in my opinion, a technology industry that just does healthcare. So you can easily relate it back to financial services, you can relate it back to banking, retail, all other kinds of industries, and what you see a lot of similarities between all the different players that are out there. And so when you have somebody like a CVS, Walmart, who've been knocking down the door for the last decade, finally coming in and making investments, and really, in my opinion, starting to impress themselves, you start to really compare yourselves to them. And when I looked at something that just happened recently, I needed a flu shot last week. So I went to my old employer, went to their urgent care center. I missed it because the driveway was before the place, brand new urgent care center, beautiful. They have 30 of them, I believe, in Charlotte. Went right past it, turned around, came around to come back in, no left-hand turn. So I had to go back to the next spot, turn around, come back in. Finally, I got into the urgent care center.
Craig, this is like metaphorical right now.
Yeah, so
for
I
what's
get in the
wrong with
urgent care
healthcare.
center, and I said, I just need a flu shot. Well, that'll cost you $90. And it was like, $90, I have insurance. Well, we're going to pay cash ahead of time, then you'll have to fill out this form and send it in. I was like, I've never had anybody ever talk me out of getting health care before. So I turned around and left, went a mile down the road, just right around the corner from where I live, walked into CVS. I didn't see they had a clinic there. So I said, I'm looking for a flu shot. Oh, the pharmacist does. Just walk back there. Walked back to the pharmacist. She came out 3.5 minutes later, $0, took my card, got my flu shot, right? So I think it just kind of shows sometimes that we still operate, obviously, the way that we always have, where we have what I would say, a very closed circuit of patients, but now patients have choice. And with that choice comes opportunity, and really the health system, I think it's obviously, in my opinion, the health systems are going to be just fine with this if they can learn to change and be competitive in this new environment.
How do they do that? How do you stay competitive when you're competing with something like CVS, where it's like, what is it? Like every American lives within 5 miles of a CVS. Amazon is delivering groceries to the back of my car. In
Right.
Los Angeles, they're piloting this right now. You can order your food on Amazon, and I have OnStar in my vehicle, and so they can pop my trunk and put my groceries in my car, and they can do it in 2 hours.
Yeah.
And you can't even get a flu shot.
Right. Well,
so how do they compete?
Yeah. Well, certainly there's plenty of bright people in the industry, and they have a lot of technology people coming in, and you also have people outside of the industry coming in, sharing with them what they've done in other spots, and you have people like Tom with big data people coming in, looking at things from the marketing consumer side. And I think, what you got to do is you really have to really treat that patient right as a consumer, as somebody who has choice, who's going to look at cost, who's going to look at convenience, who's going to make choices based upon what he or she wants that service to be, where they want that service to be. And that, to me, was the biggest thing, even with the smartphones and going to the portals and now the virtual services. So last year, when the flu season was beginning, we were asked to double the capacity of the virtual care centers that we had. So we doubled the amount of assistants that were working in those centers. We increased our capacity on the bandwidth side. Everybody's ready to start getting all these virtual care things. 3 days later, I get home and I postcard, new urgent care center, colds, flus, come to the urgent care centers. Like we're marketing to the people, but we're trying to create this new service out there. So the digital aspects of what we're doing, understanding the data from the patients and the consumers, going to them so that I'm no longer going to a brick and mortars place for care and services. I'm getting it in my pocket. I pull out my phone, I can easily access a provider and get that care taken care of right away.
Now, so I talk to a lot of startups, and I talk to, and they're trying to push a lot of this technology into the health system. And a lot of the issue that they have working with the health system is that, it's like that exchange of data so that the health consumer really can be empowered, and creating the frictionlessness that needs to happen so that somebody will reach in their phone and call into the doctor, and it's covered by insurance or whatever needs to happen, and it's not so painful of a process. So what's your advice, I guess, for the health system? How do you enable something like that? How do you enable a consumer so the process is frictionless, the same way it's frictionless to call an Uber? How do you do that when you're dealing with a health system and you're dealing with payers, you're dealing with risk, you're dealing with all of that stuff? How do you do that?
Well, you have to give the tools to the patient. He or she has to be in control of the care. No different than how they do banking today. If I want to buy something, I pull out my phone, I can go ahead and purchase off Amazon or really just about any retailer today. I don't think you want to be a laggard at this time. I really think you need to step up and be one of the leaders in your market, because those other areas, people are coming in because they already have that opportunity. They already have those services that they're providing to the patients for the CVS, the Walgreens, the Walmarts, et cetera. You name them, they're out there. And all the startups are doing the same thing as well, starting to penetrate themselves into it. So to me, it's really empowering the patient that he or she, one of the things that I used to do back, and actually one of my old provider friends is here, physician friends is here in the front, is, when we would make decisions, we would have a meter, not have a meter that would have on one side patient and the other side provider. So when we looked at open notes, or when we looked at virtual services, or we looked at hours or locations, it was like, who's most convenient is this for? Is it for the provider? Is that why our office hours are 8 to 5, and you're at locations where you want to be at, where most of us work from 8 to 5, so we need them from 5 to 8? Or is it for the patient? And all of our decisions then start going toward the patient, because that patient now is a consumer, and that person is going to make choices. If you make it convenient for the person providing the care, and certainly you don't want to burden them with unnecessary tasks and responsibilities. However, the patient's going to make a different decision quickly. So will I next year, or will my children go to an urgent care center to get the flu shot? No, they're going to go right across the street and go to one of the other places for it. And to me, there's that balance too of competition versus collaboration. So from that standpoint, I think I don't think we should compete with the CVS of the world and the other people coming into the market, but work with them. They've got to send those patients somewhere else. I think most of the healthcare system, when you look at the financials, many of us were losing money, right, on the provider and the physician side of the fence, making money on the hospital side of the fence. I don't think they're going to build those higher acuity type of tertiary care services, so have them be the feeder for you. When we looked at once with a large practice leaving the health system, it was like our bottom line actually went up, because they're still going to have the same referral patterns. They really haven't changed from when they became part of the system. And now, if you start looking at some of the other places that people are going, have them kind of feed them back into you, and you take them, give them the high volume, lower acuity, easy stuff, and have the other things come back to you. I know some people have worked out relationships with Walgreens and CVS where they're putting those retail areas inside of their hospitals, inside of their healthcare systems. It kind of reminds me of the LabCorp days from years ago, that you had LabCorp coming to your medical office buildings. And to me, I think to collaborate and to work with them together versus compete, I think that is, in my opinion, is a better way to go.
What happens to the data then? What happens to all that patient data? I mean, that's like the oil of the industry moving forward, right? It's like, who owns the data? Can you cut the patient in? Oh, the data. So what happens to the data in that scenario? If you end up partnering with, and it's a smart strategy, if you end up partnering with those consumer clinics and things like that, what happens? How do you get that data back in to the EMR?
Yeah,
Yeah,
there we go. I've always been a big fan of openness with the data, sharing of the data, built private HIEs to share data back and forth. Even with our competitors in town, we did that a couple of years ago. The intent is, in my opinion, is not really to compete on who has the data. So I have it, so I have a better way of treating that patient. It should be how you use the data is what you're competing on, not who has the data. Obviously, the patient, it's their data. They ought to have the right to it. And if I'm a patient and I want to go to a different facility, I would hope that facility or that provider has everything they can have about me. I'm picking them for certain reasons. So I think as we continue to empower the patient, get the information back to all the providers, I think the interoperability thing, that we all have Epic versus Cerner versus Allscripts, I mean, you name them.
They're calling them the cartel.
Are they?
Some of these startup conferences are referring to them now affectionately as the cartel.
Well, I was one of the few that actually was a big Cerner customer as well as a big Epic customer. Half our system was Cerner, half of it was Epic. When I started with the system, we were 3 hospitals, ended up with 42, basically split in half of how much is Cerner and how much is Epic. So from that, we were able to actually share information going back and forth using enterprise data warehouses and some of the more archaic things that are out there today. But that was part of the system, and part of our philosophy was not to rip and replace, but to build the competence to interoperate between the different providers and using the different systems that they had. As you move into value care and population health, and you have a variety of different providers in your community that you have to share information back with to make a profit, that is where you need to have that competence, because you're going to want those people who are a part of that ACO that you built to have all that information back and forth. I testified at the Senate in 2015. I had Neil Patterson at that time, he was still alive, sitting next to me. There were 4 of us testifying, and we were talking about interoperability, and they threw it right out there. The senator from Wisconsin, let's put it on the table, about Epic and blah, blah, blah. And it was just like, I really believe, and many of you may disagree, I really believe that they want that information to be shared back and forth in between. And you see them joining different alliances. Now those 2 alliances are coming together. So I think, and you have people that are gathering that data for you to consume and to bring back into the workflow. So I think the technology aspects of what we're doing is going to be less and less a hindrance. It's all going to be about people and process. Can you get the right people, and can you change your processes? If you can't change your processes, the technology really doesn't matter. If you can change your processes, the technology becomes less and less important. And you can actually utilize less and expensive and less technology if you have a better process with the right people.
Talk a little bit about that. So I had an opportunity a few weeks ago at Health 2.0 to talk to Dr. Jack Resnick. He's the chairman of the board for the AMA. And so some of those right people who often feel disenfranchised and are very vocal about how disenfranchised they feel in the health tech, health innovation space are physicians. So talk to me about, I guess, when you in your previous roles have gone out and tried to implement different technologies, how did you engage the physicians? How did you engage the nurses, the frontline clinicians who oftentimes feel like these things are pushed on them and they've still got the chip on the shoulder from EMR, and they'll never let that die. But how do you engage them? How do you convince them that whatever is next is the right way forward?
Well, that certainly is some of the battle scars that myself and many have had, because at first we didn't. We were putting this in, we were just going ahead and do the right thing that we thought, didn't really include them, started putting things into play. And I can't say that it failed, but it wasn't successful.
Well, it sounds like you learned your
Let's
lesson.
say
If now
that.
you're like, process and people, everybody.
Yeah.
Process and people.
So we actually rebranded because we had a brand for because we didn't want it to, anything with Cerner or Epic. Our brand was going across all the different EMRs because it didn't matter what the EMR had, and as we were going from 3 to 42, we had new ones coming in, and so what sat up underneath was not important to the end user. What was important was what the brand was. And because we failed at it, we switched the brand. I said, we got to call it something different. Then we created a physician, advisory group. I think many people have, and actually it has kind of like dissipated over the last several years because there's really no need for them anymore because they
I'm
actually
glad they
have.
didn't just give up.
No, they didn't give. I don't think they. I think they are accepting that's out there. Certainly, you always get the clicks, and you get the same physicians still talk about how many clicks they have and how many. But I tell you what, you have a downtime moment. They freak out. They want that information. They love that information. They like it there. They like that they have it. When you're kind of driving down the road, you can see all the different bumps in the road. But if there's no road, you really are in trouble. So I really think they've come to it. I have a son who's a physician at Cleveland Clinic, so he's young, and we have great conversations because what he learned in medical school is he is not applying that, to where he's actually practicing. Because the medical schools are still, he's still kind of teaching the old-fashioned way. I talked to the UNC school a year and a half or so ago, School of Medicine. And I talked to them about how many people have done virtual visits, how many people, started going through different aspects. Nobody raised their hand. And I said, how many people have done like a diabetic foot exam? Everybody's hand goes up. Like I said, in my system, you would never do one of those. You're too expensive. This is not what you're being taught to do is not how you're actually going to practice. And each system and each practice obviously has a little bit of variability among them. But I think as the new people come out and they start to see, and they've grown up with the tools, so they've grown up. So I remember my oldest son, when we bought him a car years ago, we got in this car and he sat in and he's like, Dad, how do you adjust the seat? I said, there's a bar. You pick that bar up and you slide. He was like, he didn't know how because everything was always a power seat, So I think as these new physicians start to be developed, and certainly I'm not going by age because I would be considered one of the elderly ones, but I think the new people are going to be educated by the healthcare system and their practices how to more effectively and efficiently manage a very large population and become more of like the quarterback of a team where they're guiding a lot of other resources to be more effective. And where they don't have a skin in the game is to move into the more complex type of patients.
All right, so I'm going to pivot a little bit here and talk about where you're at now and what you're doing now. So I understand you're working with some startups.
Oh, yeah.
So what's that like to be going to health systems and asking for them to implement your system and give you some money?
Yeah, well, this is actually kind of
on
exciting.
the other foot now, right?
Yeah, it is. So, for me, what I did was I went out and I researched about 50 different companies. And I wanted to find a handful of companies. I had 3 criteria. One criteria was, when you come in, you got to cost me. I can't ask for any money as a CIO, as a purchaser for years. So you got to come in, and it's got to be $0 to get you into the system. Number 2 is you have to have shared risk. If things don't work out for the both of us. So there's no, as time goes on, there's no revenue, there's no expense reduction, nothing that you get a piece of if I don't get a piece of it as well. And number 3 is you got to give me a double-digit return. So if I come into something, I have to have at least a 10%, hopefully 15 to 20% return. So I worked with, right now I'm down to about 5 or 6 companies that I've settled on.
Okay, so there's 5 or 6 from 50.
Yeah.
Is it because the others did not meet all 3 of those criteria, or was it? I guess I'm trying to figure out, like, how hard is it for a startup to meet those 3 criteria? Because, I've interviewed hundreds of startups, and there are so many of them that do not meet even one of those criteria, let alone all 3. So what are these startups ones that went away? Was it because they didn't meet the criteria?
Yeah, well, for the most part, I would say most of them didn't meet their criteria, but also they just weren't something that I thought was of interest.
Okay.
And
so the ones that you have.
Yeah, the ones that I have, they actually fill a specific niche within what's happening. So as a purchaser of a large system, I dealt with all the big players, and you get 80, 90% of what you need done. but there's great gold nuggets out there for these other 10% out there, of which the other ones aren't going to touch, your Epic, your Cerners, your IBMs, your Dells. They just aren't going to get into that space because people aren't going to make a buying decision based upon that one piece. So there's a hole.
Okay.
So these companies help fill that hole.
It's more like a
Bring
feature.
back large, yeah, and so
Feature that's
it was like,
funded.
if I was sitting in a purchasing seat, I would want somebody to bring those to me.
Okay, so give us an example.
Well, an example of one is, I could give you 6, but
I got 9 minutes here.
yeah, okay. An example of one is one called HMD, Honor My Decision.
Okay.
It's based on a 2016 Medicare change. It does advanced care planning. A lot of the large software vendors don't do it. It's actually funded through a foundation. So from that standpoint, it's a community service back from the healthcare system. So the healthcare system gets a 100% return. It costs them $20, $25. They get $50 back from Medicare for doing the advanced care plan. Then 36 goes into the company, and the company then takes a portion of that to the foundation.
Okay.
So that's a great example, working with large systems out on the West Coast.
What about some of the other, I guess, quickly, like some of the other issues or problems that these startups are solving, that the ones that you've decided to work with? Like, are they mostly administrative, or what are they? Because it seems like this year, more than anything, what I've been hearing talking to people is that they've moved away from the one-trick pony digital health app, and people are looking at platforms. And specifically, they're looking at platforms that can reduce administrative burden because of the expense involved in that. I think somebody had said somewhere, I don't remember where, but it was like $2 trillion out of the $5 trillion we spend on healthcare in this country goes to administration. And so it's like, I have no idea. I wish I could remember who said that. But I'm curious to know if some of these other startups that you are interested in, if they're really focused on those things as well.
Well, interesting enough, they're very similar to what we just got done talking about with like CVS and Walgreens and others. They're not healthcare specific. Only the one that I have is actually healthcare specific. The other ones are industry agnostic. So one thing that we did in the city of Charlotte, or the surrounding area of Charlotte, we started probably about 7 or 8 years ago, all the CIOs that are based out of Charlotte, and there's a total of somewhere close to about 100. About 30 of them were very active. And we started talking and started sharing things back and forth together. What we found, we had so much more in common with each other than different. But we're all brought up saying healthcare. You don't know healthcare, you know. Oh, you don't know banking, you don't know retail. No, I don't, you know. But once you sit down and start working through the role of the CIO within those industries, and I think that's why you're starting to see, in some cases, CIOs outside of industry coming in, because there really isn't that much different than what's happening in other industries. And I think the same could happen as well. A healthcare CIO could come be a CIO at an energy company. So some of my closest friends are CIOs at Lowe's Home Improvement, Duke Energy, several of these large healthcare or these large industries companies, and those we have 90% of what we do is the same. Well, I mean, and the 10% that's different, you know, there's actually, you can draw a lot of correlations between them because we are going back after the same piece.
It's kind of almost like we've come full circle. That's kind of where Amazon, Berkshire, and JP Morgan kind of jumped in. It's just streamlining that back end and applying, you know, what they've learned about supply chain and payment model and you know, just process is involved in that value chain.
Yeah, and I think for people, you know, that are making some of these, the thing that I started to do, and I think I would recommend it to pretty much any healthcare system, the things that don't make you any different than your competitor, you know, commodity type of service or program, there's people who do that for a living. So we were Cerner's largest remote hosted client, for example, by 3. We did that about a dozen years ago. We were Epic's very first remote hosted client. And when the board asked me, how come we're sending our EMR information, right? We should house it, keep it, protect it. And it was like, if you expect me to be able to preserve, protect, maintain, replicate, et cetera, all of, in this data center with this type of budget, where I got somebody who has the economies of scale that I don't have. Now, when we grew from 3 to 42, and a lot of the community hospitals or regional hospitals became part of our system, we were that. We were the big one. We were the one that had the economies of scale and could offer those types of services better, faster, and cheaper. But now I have cloud-based services. I have some of these large remote hosted places. They can do it much better than I can, and it doesn't make me any better than my competitor. And what I want to focus on are the things that are going to make me different. The analytics, the consumerism, the digital aspects, the engagement with the patient. That's where I want to spend my time. I don't want to spend on data centers or networks or field services or help desk centers. That's a big portion of a CIO's job, and I still have to manage those relationships, but I don't need to manage that as, kind of the 80-20, flip it and make it 20-80. Those things can be managed in terms of SLAs and that kind of thing and hold people accountable if you write good contracts. And let those things go. It's like a utility. We don't have our own power plants. Now, for some of us, you may have a generator in case the power plant goes away. But all those types of things come in. So to me, those are utility services. A lot of the things that we were very proud of in the past, kind of bring in your CEO or your COO, say, look at this data center with everything flashing. I don't want a data center. I want that to be a closet. The data center is going to be somewhere else that can run it much more efficiently. I got a better bottom line as a result of it, a better service level, and I can spend my intellectual capital on things that will make us different.
So this might be the end of the interoperability showcase at HIMSS if we follow your vision. Is that what you're saying? We'll just end that right there. No predictions. I do want to talk, though, about the other side of it. So if you are focusing that 80% of your time on that other stuff, on the consumer engagement side of things, talk to me about, digital health obviously is rising. I talk to a lot of different startups about that. They've got massive issues working with health systems. They've got issues getting paid. They've got issues, figuring out a business model that works, getting data, working frictionlessly with the health system. So I guess what do you see as far as from your perspective, what's the trend there as far as the digital engagement on the cell phone with the patient coming back to the hospital? How is that going to work?
Well, I think it's going to be very transparent. From my standpoint, for example, you got to have good people. So I will recognize my old CTO, Eric Christian, who's a superstar, but you got to have people who can see the future and place yourself in that spot. So when, for example, when Apple came out with the Apple Health Kit, and you had several people around the country come right out, hey, we got to integrate in the EMR, we can consume patient-generated data. I think most of us realize that, the clinical data is 20 to 30% of the relevancy of taking care of a 360 view of a patient. So now I can start grabbing some of that home data and kind of bringing it in. And it was like, we were ready to go with it, and it was like, time out. The people who have Apples, iPhones, who are Apple, are typically white-collar responsible people. The people that I want are those that are buying the monthly Android, out of the Walmarts and the Targets. Right. Those that are, that have the lower cost, higher volume type. Those are what I want. So we're not going to come out with the Apple Health Kit until I have an Android application, because that's the one. We can make the headlines, but what I want is the actual outcome to be different. And the way you can be different is by consuming the Android from those people who may not have a home, who may have a different number every month. Those types that's where we want to kind of pull that in. So for us, then a month later, we announced that we had both, and we were the first to have them both forward. But I was proud of that only because that's the population I really need to get the data from.
That's the social determinants of health issue now, is you've made technology one of them. Way to go, Craig.
Right.
So, I guess, how do you, moving forward, because I think that's a great point. That's often the most underserved part of the population. That's the part of the population where, costs can spiral out of control because they go to high cost, places for their care. A lot of the time. So it's what is the opportunity there? Let's talk about that. as far as
it's absolutely huge. And to me, I think most health systems have realized that is kind of the first step into value, into population health. You are always 100% at risk and have been for decades with that population who can't pay for the services. And so we wrote it off, increased, the receivables from payers and others, and that we call that charity care. And so now you're starting to see, if you really want to understand how to manage a well-served population, learn how to manage the underserved or the unserved population. That's where you'll get 100% return on every dollar that you save. So we focused on certain zip codes. We actually partnered with the city and with the other healthcare system within the city to look at certain zip codes and do it together. It's a community thing. This is not competitive. This is trying to get you better and trying to increase your community, make your community a better place to live. So from that standpoint, focus on that population, and you'd have a reduced charity care, but you would get people being served in the right location at the right time.
Yeah, for less expense.
For much less, yeah.
Good. All right, I'm going to ask you, we've got like a minute here left. All right, what do you think? Give us a prediction. I am going to ask you to predict. So predict the future for me, I guess, is as far as health IT is concerned, I mean, you stepped out of the big hospital system role. You're working with the startups now.
Yeah.
I mean, so what do you think is going to be the most disruptive thing? I mean, people are pointing and looking at this. The J.P. Morgan, Berkshire Hathaway, Amazon thing is like, oh my God, this is going to change healthcare forever, and it's going to change the tech side of it, especially. Others are looking at, you know, the flattening of the industry and these retail clinics and you know, retail brands like Walmart and CVS getting into the fray. They're looking at that as the thing that's going to change it, but Craig Richardville says the big disruptor is going to be.
Yeah. So what I think is, I just think it's going to continue to evolve and accelerate. I'm not going to predict like one specific thing that's going to happen. I do think that the information, the CIO role, the chief digital officer role, the chief analytics role, all those to me are things that need to start meshing and come together. Most of us built those in certain silos and have certain areas of expertise. And then when you start to try to perform and try to change the outcomes, you see a kind of a competitive spirit between them. So I think the healthcare systems that actually start to bring those different disciplines together, kind of elevate the role of the CIO, CAO, CDO, kind of start to bring it together and mesh together, I think are the ones that will be the most successful, because they won't have the inner politics of who's going to be doing this and who's going to be doing that. It's all going to fall within the umbrella of a C something O that manages all those different areas. So to me, I think bringing all that together would be the next big step. And then the CIO, I mean, we are becoming a digital industry. So understand the business. Being a technologist or having a technology background is fantastic. But obviously you don't speak that to other people. You speak business, you speak outcomes, you speak clinical outcomes, patient satisfaction, engagement. You speak the terms that will actually change the business of healthcare and learn that business. And the technology piece, like I said earlier, to me is going to be kind of almost like the non-event. We're all going to have that piece of it. It's going to be how you apply it and take advantage of it that will make you better than the other.
Great.
Great.
Well, Craig, thank you so much.
Well, thank you for your time.
Pleasure to talk with you.
Thank you, guys.
Thank you. Thanks, everybody.